When I told them I intended to keep both surgical opinions, they said again, too, this is not allowed in our office. Either you go with us or you don't book an appointment, period. And I said, well, I'd have to think about that. They had asked me who the second opinion was, and I told them, just trying to be honest. Well, little known to me, as soon as we finished that conversation, the first surgeon's office, who I had just spoken with, called the second doctor's office and canceled my appointment for me. Again, too, I was just appalled that they would take that matter into their own hands and not allow me to have a second opinion when I felt it was entirely a right of any surgical patient to have two opinions. So again, too, if this is where the top surgeon is treating cancer patients, again, it just led me to believe that I was going down a journey here that just was going on evidently right and left all about me, and I had no idea until I was actually the patient or the victim myself. So I say all this that I think Sylvia and I agree, your previous patient who talked, that it gave me opportunity just to stop and to pause and to pray and to really realize what's going on and how I is being shoved through this corridor of just blindly following. And of course, there's a lot of fear, and I understand how a lot of patients maybe don't feel that they have a lot of time to research, but to me it was just too much being coerced into doing what somebody's telling me to do without telling me why or how come. Like I said, I have kind of an analytical mind, and I just would appreciate somebody sitting down and explaining things to me, which I didn't feel was happening at all. So I did. I did a lot of stopping and praying and talking to the Lord and just trying to find out what He wanted me to do. And I really feel that I was being led not to have what they wanted to I hate to use the word forced or coerced, but that's indeed the only opinion I was getting, was to do what they were telling me to do and don't even ask questions or look other ways of treatment. So anyhow, I thought maybe this was just small-town politics. My next step then was going to be going to the State University Medical Facility, which I did about 3 weeks later. Just to show you the extent of the bruising that I had from that ultrasound procedure, I did see a surgeon at the medical facility of our state, and first thing she said to me was, there's no way I can even do surgery on you for another 3 weeks because you're so bruised and scarred and purple from the radiologist who had tried to do the biopsy on me. So again, too, that again reinforced the fact that things were not done properly. But what they did tell me is, again, surgery, radiation, and chemo, that's the only choice you have. Otherwise, you can have a mastectomy with reconstruction. And it was just way too complicated for a 2-centimeter lesion that I had in my breast. I just didn't feel that we had to get to all these drastic decisions. And again, the good Lord did step in because we had Christmas break and everyone decided to go on vacation. And so I had about 2-3 weeks, plus I had this purple, enlarged, swollen breast from the bleeding of the biopsy, and nobody would touch me for several weeks, and I really think that was a godsend, that I had time just to sit back and say, what is going on here, and what alternatives do I have? So I took time, and I think that's the one thing that a lot of cancer patients don't think they have, and sometimes they don't. But when I asked the nurse how long I had probably had this, there goes your buzzer.
We got the break.
Okay.
So we'll continue after. We're back, and Dr. Evelyn is still here, and she's going to continue with her very interesting story.
Okay.
Go ahead.
So I think where we left off was the idea of time. When I had talked to, which is something now that I see a lot of breast cancer centers having, which is a nurse coordinator, a nurse advocate. She was a very delightful person, very concerned, very compassionate, but I really feel that, again, too, that this is an instance where your emotions are so involved. And when I asked her, how much time did I have as far as how long this tumor of 2 centimeters diameter had been growing there? And she said, well, it's been there at least 10 to 12 years. And again, too, another thing that came to mind was I have been having mammograms for the past 10 to 12 years yearly, and nobody suspected anything. And this was, I guess, just the frosting on the cake of saying, my goodness, if doing everything right can still lead me to this situation, what is wrong with our medical situation that we are not detecting these tumors? And you're hearing on the radio that, cancer being diagnosed in record quantities. And, boy, not with me, not for 10 to 12 years of doing everything right and still not having the right outcome. So anyhow, again, to all these things, I just think were God's sense of trying to open my eyes to the fact that I wasn't just going to follow the same road any longer, because the same road of doing everything that I thought was right was not getting me to a good outcome. So that was my point to be made there. So I did take time. I figured if it took 10 to 12 years to get to the point it's at now, then I need to take a little bit of time and study and research and figure out which direction I wanted to go in. And so I did. For about 4 months, I really researched the alternative fields and did a lot of cleansings and diet alternatives, and really searched and supplements and the whole issue there. But I do want to caution your listeners that the alternative health fields, as was a big surprise to me and a lot of the people who I was also studying with who also had cancer and were looking for other answers, is a big money-making industry also. And there's a lot of people out there who say they're doing this in an altruistic manner and trying to help cancer patients, but there's a lot of people also taking their money out there that are not having success rates. So again, too, I just would like to put out some caution there that just because they're alternative health programs does not mean that you need to do your homework. And I think that's a big important part of what I want to say here. So the alternative programs was something I was looking into for about a good 4 or 5 months. I came across photodynamic therapy and hyperthermia as I was doing my research, and I even called back east to several institutions and university hospitals that talked about doing it at their facility. And I think what really was a big aha moment for me was when I found out that photodynamic therapy and hyperthermia had been used for a long time on chest wall recurrence of breast surgery after mastectomy had been done, which told me that, number one, mastectomy is not working, which was told to me by the doctors that you did not have to have the surgery, radiation, and chemo, surgery meaning lumpectomy, I should clarify, if you wanted the mastectomy, because that was so curative. Well, it was not curative if they're doing chest wall recurrences on the East Coast on a routine basis on women who had mastectomies. So a big indicator for me that, again, too, what we're doing is not working. As a result of that, finding that this therapy was well-renowned and working well for people, I then discovered Dr. Carpenter through a lot of my research, and when I called Dr. Carpenter and started to ask my questions, I was given other patients that I could contact, and believe you me, I contacted every single one of them. I think I kept them each on the phone, God bless them, for a good hour and asked all my questions. And again, too, a lot of prayer and a lot of, trying to find out what God wanted me to do with this journey now that was taking close to a year of just researching and asking questions and trying to figure out what was the best for me. But I just knew down in my heart that I did not want to go the traditional route. And I kept asking the Lord, don't let this be just stubborn pride, but I just really do not see by all the blunders that had been made on my journey that what everyone's telling me to do was going to be a curative, a sure thing. And they even speak of it as being a survivor. You're still not cured of cancer with all the traditional measures that they tell you about. You're only a survivor, meaning that at any time the cancer can come back. And it probably still could to some degree now. But I think I've gotten a new appreciation of just thanking the Lord for each day. I thank Dr. Carpenter for what she did for me. When I went to see her and I had the procedure done, I was there for 3 days, and it was, I had heard there might be some minor pain. Well, my goodness, minor isn't even a word to describe the comfort that I went through the entire procedure with. I talked with her through the entire procedure. She answered every question I could possibly think of, and believe you me, I've got a questioning mind, and she was very forthright with all the answers and the precautions, and we were able to discuss, because of my history in the medical field, I've used lasers myself on numerous patients, as has my husband, probably thousands. We own lasers in our office and perform daily procedures with them. And I respect what the laser is able to do, and the embellishments that Dr. Carpenter has been able to make with her patented procedures that she's come up with, and the length of time that she's spent in doing it. And I can't help but think that, why would somebody who is being chastised by the medical community, which